was talking to my psychiatrist, and he asked, have you ever thought about volunteering at Inpatient Mental Health Services? And I said, no, but I will. Tell me more. I had a hard time when I first started volunteering. And then, of course, I had the idea, like, what if I started a group, a drawing group? Do what I love, draw cartoons, listen to the music I listen to, have some fun.
I love the idea. I love the idea for the patients that he would be serving, but the initiative to come up with something independent on his own that he could roll with, loved that.
Dwight had just started as recreation worker, and he asked me, are you the guy who does the cartoons? I said, yes, I'm the guy. And he says, well, why don't you bring your cartoons next week? We just did it, and we had 9 people that first night, and that's when I knew that this is going to work.
It was a very calm kind of feel, and David just kind of fired up, and I think we started with drawing some Shrek.
I drew Marge Simpson and Glenn Quagmire. I wasn't expecting to have fun. I was expecting to sit there miserable and do a terrible drawing, and I surprised myself with a good drawing. I was in super rough shape, and I knew I was in good hands when Dave took his lanyard off and his vest off and said,
take off any form of volunteer status, and for the next 10 minutes, I'm going to be just another patient. All right. I got my first mental health diagnosis in the fall of 1995. My name is David Field. Welcome to Groovy Toons.
Well, in the early days, we actually used to do surveys, and I looked at all of them. I can't remember a single negative comment.
The idea just kind of snowballed. What if we do it in adolescent psychiatry? And of course, I said yes, I would love to.
Having David on the unit for the first time was very welcoming. David set up like a really nice environment for our patients to be in. Yeah, I just felt really good about being there.
Dave just made it clear that this was an accessible environment. He was very encouraging, he was very positive,
It's a welcoming environment for everyone.
It's great because if they succeed at the end, they're super proud of their project and they want to show it off and they just feel rewarded. Always bringing in new stuff to the unit is super important.
Programs like Groovy Toons are really important to people's mental health.
It's kind of cool to be able to meet with people that get it.
David just presents himself in a way that's just very down to earth. The kids can kind of see that people do struggle with mental health and are able to follow through with their journeys, and they can live a positive, successful life.
When Dave tells his story, I can edit that in my mind and put my name in there.
Knowing that I wasn't alone was probably another one of the biggest things.
We're just very blessed to have David come in because that's an extra perk. But I also feel that is essential to our mental health.
For me, it was essential.
As a former staff member, I totally would say it's essential. The patients need something more than meds and being in their room and 3 square meals a day.
It was definitely a highlight in the hospital, but yeah, it definitely helped my stay there.
This activity was definitely helpful for my mental health. It brought me out of my little hole I was in and gave me hope.
It kind of made for a very relaxing evening. It took away some of that, took away some of the loneliness even at night there.
Groovy Toons helped me to connect with the other patients, which I was unable to do for the previous 2 weeks that I was in the hospital.
And I think the next couple of days, obviously the people that were in there, I think we maybe chatted a little more, even at breakfast or at the meal times and stuff like that. So. It was good. Very good playlist.
It's all instrumental. It's easy to talk over it.
Love the music. I think it sets the environment. It's very relaxing.
It's very chill. It's very peaceful. And I've had people tell me that it helps ease the anxiety or take the edge off.
The music was awesome. Groovy Toons it's aptly named.
We're missing opportunities to provide for our kids outside.
I would love to see a program start for patients who are discharged, like a patient aftercare program where they can continue on with these activities.
Sometimes leaving the unit, they don't have those things to attend, or just even being able to socialize and relate to other people that are struggling with mental health.
I think it would just be really, really beneficial and really kind of keep people grounded and keep people connected.
Programs like Groovy Toons bring people together.
I just think cartoons are just fun.
Fun, again, hard word when you're in the hospital for major depression.
People need wholesome activities. People need fun in their lives.
It's a really very good program, and as I continue to recruit, I will be talking about it all the time. It was a springboard to other volunteer-led group activities.
It was a great fit for our unit.
We started this together, and we started off with 1 unit. We're at 3 units, and it's very successful. It's extremely popular.
Kids that have been there for 2 weeks look forward to having David come back.
It's probably one of the things I'm most proud of in my 6 years of working in this department.